review a couple of things, and then, like I said, I'm going to take it to the board. Cool. So this is kind of just right out of your chapter here toward the beginning after the anatomy and physiology. So what are the major life threats? So somebody presents with abdominal pain. What are the main life threats we need to immediately rule in or rule out if we can?
Ectopic pregnancy.
Good. Ectopic pregnancy. Whoops.
Appendicitis, maybe.
Just bleeding in general.
Yeah, so ectopic pregnancy, specifically a ruptured ectopic pregnancy, okay? And why is that such a problem? It leads to hemorrhage, right? Cool. GI bleeding, you guys are absolutely right? Why? Because it can cause exsanguination via hemorrhaging. A rupture of an aneurysm, abdominal aortic aneurysm. Anyone care to guess why that might be deadly?
Just blood in like 2 pumps.
There you go, yeah. And what about splenic rupture?
Same thing.
Same thing, right?
It's all about bleeding.
Yeah, it's all about bleeding, right? When we talk about like an appendix rupturing or a bowel perforation or something like that,
Small sepsis.
yeah, they will kill you for sure, but the death tends to be longer, slower, agonizing, okay? Which is still terrible, but it typically won't kill you during a 5 or 10 minute ride to the hospital, right? But these are the things that will kill somebody. And so if you suspect these things, these are like, okay, I need to get off scene. I need to rapidly take this patient where they need to go. Okay, cool. So you guys okay? We've talked about AAAs already in cardiology with the signs and symptoms of a AAA, right? A pulsatile abdominal mass, syncope. They look like they're in shock, right? They may have a tearing or pulsatile pain. They may have neurological signs, right? Paralysis, things like that as perfusion and nerves get disrupted.
Now would not the rupture of the, but the, what is the word I'm looking for, where it like tears a little bit, and it's just, is that still dissection, there you go.
Well, you can get just a little tearing of an aneurysm as well.
Oh, okay.
Yeah, so both dissections and aneurysms may have a presentation where you kind of get some leaking and then it kind of tamponades off a little bit, or maybe a clot develops and plugs it off a little bit. You can get that kind of intermediate presentation as well. Yeah, definitely. Ectopic pregnancy, how do they present?
Acute pain.
Acute, is it unilateral, bilateral?
It's usually unilateral.
Unilateral, where does it tend to start? The lower quadrants, good, okay. And who do we see this in? Yeah, women of childbearing age, good. Splenic rupture, okay. We see, this tends to be more traumatic, right? But this can occur in certain viral illnesses, right? Such as mononucleosis or Epstein-Barr virus, right? You can get swelling of your spleen and your liver.
Yeah, they were saying that's usually coupled with like a minor trauma.
Yep.
Minor.
Yep. So, they tripped, fell, or, yeah. So this is actually, yeah, that's one of the major concerns with Epstein-Barr viruses and certain other viruses. You get swelling of your liver and your spleen, and they could be more prone to rupture, like, if you trip and fall, or, you're playing out on the playground, something like that. Where's your spleen located? Left upper quadrant, right? So left upper quadrant pain, you always want to be thinking the spleen. And can that refer as well? Where? Into your shoulder, yeah. And actually, anytime you have bleeding in your abdomen, the same nerves that innervate your abdominal wall also innervate up here, so you can have that referred. Anytime the peritoneum becomes irritated, you guys okay with that? And that, what's that?
Isn't the area hot and distended?
May or may not be. Yeah. What causes distension? What do you guys think? Blood? You agree blood causes distension?
Swelling.
Swelling causes distension? Liver, not so much. Huh?
Air.
Air, maybe? How much blood can you lose in your abdominal cavity?
Way too much.
Can you quantify that a little bit more?
Death
Okay.
without seeing it, like 2-3
Okay.
liters.
How about everything?
Yeah.
Yeah, you
without seeing it.
you can lose your entire vascular volume into your abdominal cavity, and there can be no indication that there's any blood in there. So it's not the blood so much that causes the distension. It can be, but oftentimes it's the muscles of the abdominal wall become irritated by blood or inflammation, and they begin to spasm, and that's actually what you're seeing through that distension. It's actually the muscular spasm. Yeah. Because you can safely lose every drop of blood in your vascular system into your abdominal cavity and not really have any over indication of that. Yeah. Because and we do this, like one of the ways we can dialyze patients is by using the peritoneal membrane, and we'll dump a bunch of hypertonic fluid into their, like liters of hypertonic fluid into their abdomen. And then that hypertonic fluid will draw stuff across the peritoneal membrane, toxins and things like that. Nitrogenous wastes get drawn in there, and then we go ahead and release all of that fluid that we put in the abdominal cavity, and all those toxins and nitrogenous wastes come out with it. It's called peritoneal dialysis. And we can easily put liters of fluid into patients that way. And we'll talk about that a little more in renal. Okay, some assessment signs that you want to be familiar with. These occasionally make their way onto exams. Okay, so you have signs that look at the gallbladder first of all. Okay, and one of the classic things is, where's your gallbladder located? Right upper quadrant, right, the inferior aspect of the liver. So one of the things that we do is we grab the rib cage, the inferior costal margin, and you can kind of stick your fingers in there a little bit and kind of wrap them around the rib just a little bit, right? And then you ask your patient to inhale. And normally the liver and the gallbladder just kind of get pushed out of the way, not a big deal, right? But if somebody that has gallbladder inflammation, what will happen? They won't be able to inhale. It'll be too painful. And if that happens, that's known as a positive Murphy's sign. You guys okay with that? Murphy's sign. That's a gallbladder liver issue. Okay? Now, remember when we talked about a splenic injury causing referred pain into the left shoulder? That's known as Kerr's sign. Okay? Kerr's sign is indicative of a splenic issue. And then we have two major signs associated with appendicitis or just peritonitis in general, an infection or inflammation of the peritoneal cavity. Okay? The first one is the Robsing sign. Okay? And this is pain in the right iliac fossa with palpation. And that kind of makes sense, because where is the right iliac fossa? What structure is in there?
That right iliac.
Yeah, the right iliac fossa. The appendix, McBurney's point. Yeah, McBurney's point tenderness, yeah. And then there's something called Cullen's sign. And this is bruising around the umbilicus, or the belly button, right? Or what we call periumbilical bruising. And that indicates that there either is some blood accumulating in that area, or some sort of infection, and that's indicative of potentially a ruptured appendix. Okay? And then there's another sign which is not abdominal specific, but it is something known as Gray-Turner sign. And does anyone know what Gray-Turner sign is? So Gray-Turner sign is bruising along the flank, which is also known as the costovertebral angle, or the CVA. CVA bruising. And where would that be? What organ is in that area?
Kidneys.
The kidneys, right? You guys cool with that? And when you have bruising around the flank, or this positive Gray-Turner sign, that is indicative of a renal problem potentially, or in some cases it can be bleeding, okay, that is collecting down there. And often that is the result of another organ called the pancreas, which we've already talked about, right? Like hemorrhagic pancreatitis or pancreatic rupture or something on the lines of that. So are you guys okay with these signs? The Rovsing sign, the Cullen sign, Kerr's sign, Murphy's sign, and Gray-Turner sign. Unfortunately, these are not talked about in the book. Rather, the book talks about them in more practical terms. Bruising around the umbilicus is what the book says. Pain with palpation to the right lower quadrant. Bruising to the flank. But I want you guys to be familiar with the proper names for those findings because they do tend to make their way onto tests. And so a test may not say that your patient has bruising around their flank. It may say your patient presents with hypotension and positive Gray-Turner sign. What problem is most likely to be occurring? A, B, C, D, right? And then you've got to know, oh, Gray-Turner sign is referring to bruising along the flank. Does that kind of make sense there? Or Cullen sign is periumbilical bruising. You guys cool with that? Okay. Like I said, I didn't see those really well articulated when I went through the chapter, so I wanted to make sure we're okay there.
They're just in different chapters, Chris.
Yeah, they kind of split it up a little bit, don't they? But they don't have it like, I wish they had like a table that just kind of brought it all together. And maybe there is, I just didn't see it in the GI reading, so I wanted to just cover it here, and that at least we've talked about them.